Hi everyone, today I wanted to talk to you about the central venous catheterization procedure commonly done in the emergency room setting. So the indications for this procedure are central venous pressure monitoring, emergency resuscitation, hemodialysis, parenteral nutrition, pulmonary artery catheterization, and medication delivery. The contraindications for this procedure are infection at the site insertion, thrombosis of the vein you are trying to cannulate, and coagulopathy. Today I want to talk to you about the internal jugular vein insertion point. We're going to be at the patient's right side. This blue represents the internal jugular vein. The insertion point is at the apex of the two heads of the sternocleidomastoid muscle, which is represented in green. This is the clavicular head of the sternocleidomastoid, and this is the sternal head of the sternocleidomastoid muscle. So like I said, apex is the internal jugular vein. Medial to that is the common carotid artery. That's what we don't want to nick, okay? Now, when we do this, you want the patient turned towards their left. The head is lower than the feet. This prevents air embolism and allows for vein engorgement. Now, the internal jugular vein is only one of three insertion points. The other two are the subclavian vein and the femoral vein. This is the internal jugular insertion point. Now, obviously, this would be done under ultrasounded guidance. If for whatever reason you didn't have an ultrasound readily available, although it would be less precise to do it this way, you could feel for the two heads of the sternocleidomastoid muscle, and again, at the apex of those two heads, you would insert there. It may be helpful to feel for the common carotid and then go lateral to that. And this is at the level of the thyroid cartilage. So you want to move lateral to the thyroid cartilage, lateral to the artery, right there. And that's where you hit the IJ. We have our materials all laid out in order. We have our patient here covered with a sterile drape, and we're ready to go. Obviously, all of this will be done under sterile conditions. It would be fully draped in a sterile gown with sterile gloves, but the purposes of this demonstration, I have just put on a regular pair of gloves just to show you. Okay, so first we want to make sure our triple lumen catheter, which is this piece here, is working. We want to make sure each line is cleaned. So first, we want to take off each cap and make sure, I put this tray here to see whether there is a free flow of liquid. And as you can see in the tray, you can see the water flowing through the catheter, which means this line is clean. We want to close it after we're done testing it. Move on to the next line. Open it. Ensure there's a free flow of fluid. As you can see, there's a free flow of fluid there. You want to close the line. Move on to the third line. Okay. Close the cap. Now, in most triple lumen catheters, this middle port will be brown. That's the port that the wire will go through. Okay. After we ensure that the lines are patent, we want to prep the skin. This is our core prep. We want to push inside, and we're entering at the right internal jugular vein. So you want to press inwards and just clean in a circular format, just like this. Okay. After you're done cleaning the skin, you want to anesthetize the skin. Right here we have our 1% lidocaine, and we have our gauze here to break open the lidocaine. Okay, we have our drawing up needle, and we have our injecting needle. And this is our 3cc syringe for the lidocaine. So I'm just going to attach this drawing up needle. Okay, we want to break open the lidocaine. So the key is to use some gauze, and you want to break the ampule towards you so that if there's any shards of glass, it's not coming towards you but away from you. Here we go. Now we can put this in the sharps. Next we have our drawing up needle. So we want to replace the needle with the injecting needle for our lidocaine. We want to make sure the bubble is up and it's facing the numbers. We're going to be injecting in a fanning motion, and we're also going to be injecting where the line will be secured with sutures. So as we inject, we want to withdraw as we inject. Withdraw, inject. Withdraw, inject. Ensuring we are not injecting into the vessel. Now I'm going to be injecting where the line will be secured. Now we've ensured the patient is fully anesthetized. After we're done, we want to place our needle into the red gap. So at this point, we've identified our vein and we are aspirating as we go into the vein. Okay, we're going to pretend like we have continuous flashback. What I want to do is just take a piece of gauze and hold it over the hub of the needle to prevent any kind of air embolism while we remove the syringe. Now we're going to introduce our J-wire tip into the needle hub. Take off the straightening adapter and remove the needle, making sure not to ever lose track of the wire. Now what we're going to do is we're going to use our scalpel to dilate our insertion track. Make an incision there. Now we're going to introduce our dilator over the wire. This is going to deepen our insertion track so that the catheter can be moved through the vein. Okay, we just need to insert the dilator up to 3 to 4 centimeters, and then while holding on to the wire, you want to remove the dilator, always holding on to the vein, to the wire, sorry. Now it's time to insert our triple lumen catheter. Make sure that the middle port here is uncapped. This is the port where the wire will come through, so it can't be capped. You want to introduce the wire, and as you can see here, the wire has exited the middle port. So you want to just keep moving the catheter through. Okay, keep pushing it in, keep pushing it in. Now you can remove the wire after the catheter has been placed into the vein, and you want to insert it up to the double black lines. Since this is a model, I'm just going to push the catheter in at the desired length. On a real person, you wouldn't do that. Now the double black lines is where you want to secure the fasteners so that the wire cannot be removed even if the patient pulls it. We have a white fastener and a blue fastener that goes on top. This will secure the line in place. So what I want to do is go ahead and attach it at that point. Secure the blue over the white. And we're going to go ahead and secure the line with a suture. So I have a 3/0 silk suture and I have my needle driver, and I can keep my scalpel here just to cut the suture when it's the right time. We have two fasteners here. These two double black lines represent 20 centimeters. So you want to secure the line in place with this white plastic closure, and then cover it. This will snap into place with the blue. Now you can see the 4 points of suturing clearly. 1, 2, 3, 4. Then this ensures that the central line stays in place, and I've secured the line in 4 places. 1, 2, 3, 4. I used a simple interrupted suture and tied it with a one-handed tie. This blue cap is sitting on top of a clear white cap that comes from the central line kit. That is sitting on top of a double black line, which represents 20 centimeters. This is proximal to the patient's head, and this is the distal portion.